Good morning everyone. Myself Anitha, Nursing Tutor, ES College of Nursing. I am going to discuss about communication and methods of communication. What are the barriers of communication? So what is the definition of communication in a sense? Communication is a process of which information is exchanged between the individual through the common system of symbols, signs and behavior. So what is the purpose of communication? Why we have to communicate with the people? To collect the assessment data, to initiate intervention, to evaluate outcome of intervention, to initiate change which helps in promoting health, to take measure for preventing legal problems associated with nursing practices, to analyze factors affecting the health team. So what is the process of communication? It is a step-by-step process. We have to send a message to the sender. The message should be encoding and decoded at the receiver end. They are receiving the message, then the receiver can give the feedback to the sender. So first is message. So what is message? Message is a key idea that the sender wants to communicate. It is a sign that elicits the response of recipient. Communication process begins with deciding about the message to be conveyed. It must be ensured that the main objective of the message is clear. The next one is sender. The sender is a person who sends a message. A sender makes use of the symbols. A sender may be an individual or a group or an organization. The views, backgrounds, approaches, skills, competencies and knowledge of the sender have a great impact on the message. Next, encoding. Encoding is a process where the information you could like to communicate gets transferred into a form to be sent and decoded by the receiver. Channel. The channel or the ways convey your messages. The channel include verbal such as a telephone and face-to-face conversation, as well as non-verbal symbols such as emails and text messaging. Each individual channel has its strength and weakness in terms of communicating. Next one is decoding. So decoding is on the receiving end of communication. This stage is just as important as encoding. Communication can go do well. At this stage, if the receiver is not practicing active listening skill, or if they do not possess enough information to accurately decode the messages, the decoding will be having a great failure rate. And next one is types of communication. There are several types of communication. First one is formal communication. Formal communication means a conversation between official on various positions. For example, nursing superintendent or staff nurse. A conversation between the nursing superintendent and the staff nurse is the example for formal communication. And next is informal communication. So informal communication is a conversation between the people on non-official matter. Example, interaction with two close friends is a part of non-formal communication. And next one is one-way communication. It is always flows in one direction. There is no feedback. Example, lecture delivered by the teacher in the classroom. It is an example for one-way communication. Two-way communication. So in conversation, feedback is present. For example, group discussion. And next one is visual communication. Message is conveyed using symbols. Example, displaying a posters or models in the exhibition is an example for visual communication. And next one is telecommunication, communicating in distant places with the help of electromagnetic appliance. For example, television, radio, internet and etc. So what are the skills needed for effective communications are confidence, critical thinking, analytical skill, open-mindedness, active listener, empathetic, honest, confidentiality, knowledgeable, systematic and tactfulness. So these are the skills needed for the effective communication. And next we are going to discuss about the barriers of communication. So what are the barriers we can face during maiden conversations? Or first one is physiological barrier. So physiological barrier in the sense there is a difficulty in hearing. The sender or receiver end may having a difficulties in hearing, or difficulty in vision, or difficulty in expressions, or the physiological barriers. And psychological barrier. So psychological barrier in the sense the communicator who's sending the message or in the receiver end should have an interest. So if they having any emotional disturbance, it may having a psychological barrier, fear and level of intelligence. Environmental barrier. So in that environmental barrier, there is a lack of ventilation and lack of privacy or overcrowding. Overcrowding is an is all the example for environmental barrier. The next one is cultural barrier. So in that cultural barrier, there is a level of knowledge and understanding between the two communicator, and customs, beliefs, religion, language and ecostic. These are all the cultural barriers. So till now we have discussed about the definition of communication, what are the types of communication, what is the purpose of communication, and the process of communication and barriers of communication. Thank you for watching.